Hello friends, this is Dr. Mayank Gupta, Senior Consultant and HOD at Department of Urology, Uro-Oncology, Kidney Transplant and Robotic Surgery at Dharamshila Narayana Superspeciality Hospital, Delhi. Today I am going to discuss about prostate health, what should men do and what should they avoid to maintain a healthy prostate health. As we all know that prostate is a gland in the male urinary system, and almost all men above the age of 40 will experience some prostate related health issues. The prostate gland is a small crucial gland in the urinary systems which generally secretes fluid which is vital for the sperm's health or the seminal fluid. And as as the age advances, the prostate disease is very common above the age of 40. So as men age, the prostate gland gives some conditions which can impact his quality of life and can pose a serious health hazard to him. So in the list of conditions which pose a risk hazard or health hazard is BPH, that is the benign prostatic hyperplasia. The symptoms of BPH include frequent urination, urgency, night urination, that is nocturia, weak flow of the urine, intermittency, hesitancy, incontinence. All these symptoms they point towards a condition known as BPH. The second disease or the second problem which the men face is the prostate gland infection, that is the prostatitis, which does not pose a fatal kind of risk or a fatal condition, but it can cause great morbidity and discomfort to the patient, as the condition most commonly leads to a chronic prostatitis. The third and the most significant thing which the prostate gland can cause is the prostate cancer. And people who are direct in lineage, or means any of their relatives, especially father or uncles, if they have prostate cancer, are more prone to the hereditary lineage or chances of developing prostate cancer. So the people who are above the age of 40 and have a hereditary of prostate cancer should be very careful and should undergo a routine blood test, that is PSA, every year without fail to prevent an prostate cancer in advanced form, and so that we can diagnose their cancer at the early stage. So generally people have a question that how do I detect or recognize that I have a prostate cancer? So the simple answer is that the prostate cancer itself does not have any sign or symptoms. It is generally the symptoms of urination which I discussed earlier of BPH which lead the patient to the doctor, and his prostate cancer is diagnosed by the clinician. So the people should not wait for the symptoms, and prostate cancer can be checked by a very simple blood test, that is PSA, which the people should undergo every year above the age of 40, 45 or 50, so that they can detect the disease in its early stage. So the people should not wait for the symptoms to occur. If the patient comes with the symptoms of the disease of prostate cancer, it's mostly in the advanced stage. So how do we maintain a healthy prostate health? The maintenance involves some regular exercises, some antioxidants, fruits, vegetables, that is healthy food habits, regular exercise, avoiding smoking and alcohol. So men should also be encouraged to discuss about their urinary or sexual health with their physicians without feeling any embarrassment or delay. So in conclusion, I can say prostate health is not only about Preventing disease, it is also about preserving quality of life, which can be very badly affected by prostate disease if it is left uncured. So, in nutshell, I can say that early action can lead to early solutions and the peace of mind. Thank you.